You are listening to part 49 of our series, 7 Medicines, The Wise Woman Way, with Susan Wade at Time Monk Radio. Hello, Susan, and welcome back to Time Monk Radio.
Oh, thank you, Gemini. It's always such a delight to be here with you. I'm really enjoying taking this very leisurely ride down the 7 rivers of medicine. And it's rather exciting for me because often when I'm teaching about the 7 rivers of medicine, I have a very limited amount of time that I can teach. And since I'm truthfully not that interested in drugs, I leave them to the very end and just kind of say something general like, drugs, don't take them, do other things. But because of the generous time that we have here at Time Monk Radio, I've really been getting down and getting into it and really looking into the particular drugs and not just giving you information about herbs you can use instead, but really giving you some solid information about these drugs. And we're about to start our segment on 2 of the leading prescribed drugs in the United States, and that's drugs to lower blood pressure and drugs to lower cholesterol. In fact, treatment of hypertension, that's high blood pressure, has become the leading reason for visits to physicians, as well as the leader in drug prescriptions. In fact, more than 1 in 3 Americans is taking blood pressure drugs. Americans are spending about $10 billion a year on drugs to lower blood pressure and billions more on medicines to deal with the side effects of those antihypertensive drugs and to treat the heart attacks and strokes associated with those blood pressure lowering drugs. I know. That's hard to hear, isn't it? But indeed, although lowering your blood pressure is put out as being something that you need to do to prevent a heart attack and to prevent a stroke, as we're going to get into this, we're going to see that the truth is something quite far from that. There is substantial evidence, not just a little evidence, not just one study. We are talking decades of gold standard studies, substantial evidence that lifestyle changes alone reduce blood pressure. Still, blood pressure drugs are the most common form of treatment for blood pressure. So let's back up one step. What is blood pressure anyhow? Blood pressure is the amount of resistance that a blood vessel offers to the passage of the blood through it. So let's think about this in really simple terms. The heart is pumping. It's going thumpa, thumpa. And as it does that, like any pump, think about an old water pump where you pump the handle, ka-chung, and water comes out, ka-chung, and water comes out. So each time the heart goes thumpa, blood is forced out of the heart and is forced into the circulatory system. Blood pressure measures how much force the heart is putting out in order to get that blood to move through the blood vessels. The primary thing that raises blood pressure is the blood vessels themselves getting stiff. Blood vessels are fairly complex tubes that the blood goes through, and they are lined with endothelial tissue. And these endothelial tissues are very active tissues, just like the lining of the digestive tract, the lining of the reproductive system. These lining cells are very, very active cells. And within 4 hours of sitting still, endothelial cells start to dry up and to stiffen up. We can see what happens as we age. We can see what happens if we have sedentary jobs. And that is that our blood pressure is going to go up because the blood vessels are stiffer and it's harder for the heart to push the blood through them. If there's cholesterol plaque or calcium particles or sticky blood cells in the blood vessel, the blood pressure will also rise because it's harder to get that stuff through the blood vessel. And when we are tense, rigid, constricted, or worried, our blood vessels constrict, get rigid and tense, and blood pressure rises. So 3 primary reasons for our blood pressure to rise: blood vessels getting stiff, stuff in the blood that shouldn't be there, and tenseness and rigidity and constriction in our bodies, minds, and emotions. High blood pressure causes wear and tear throughout the entire cardiovascular system, as well as in the kidneys. So there are good reasons to pay attention to your blood pressure, but there aren't good reasons to take drugs to lower your blood pressure. Well-designed clinical trials by the hundreds have found that drug therapies used against high blood pressure are ineffective at preventing heart disease. Certainly, we want to keep our blood pressure in a healthy range because high blood pressure has been called the silent killer. In fact, high blood pressure doesn't really give you any symptoms. If you have very low blood pressure, you're going to faint, you're going to have blurry vision, you're going to be exhausted. You're going to know that you have low blood pressure, which is kind of rare. But high blood pressure, you won't necessarily know. And how do we measure blood pressure? You know. You've seen it on TV. You've even had somebody do it to you. There's a cuff put around your arm, and it's inflated, and that actually cuts off the blood, and then the air is gradually released from the cuff. And as the blood flow returns, we first measure the pressure when the left ventricle fills, and the heart beats. That's the upper number, the systolic pressure. And then when the heart is refilling with blood, the pressure between beats can be measured, and that's the lower number, the diastolic pressure. Healthy blood pressure is currently defined as no more than 120/80. Blood pressure of 139/89 to healthy blood pressure is now being considered pre-hypertension. So, in fact, it used to be that blood pressure of 139/140/89/90 was actually considered for an older person to be okay. As a matter of fact, my first training said that you could add the person's age to 100, and that would be an acceptable upper number. We no longer believe that at all. In fact, I would have to say that one of the places where we are changing our tune about medical advice for people the fastest is around blood pressure. And one of the very rapid changes that's been happening is those numbers have been coming down and coming down. Studies have been showing that lower blood pressure, so long as it's not low blood pressure, is probably going to help people. High blood pressure, first stage, 100 up to 160/100. Second stage, up to 180 and 100 plus. And emergency care is immediately required if the blood pressure is more than 180/110. One of the rather new things that we're doing is to measure the blood pressure in both arms. And if your doctor or healthcare professional is not doing this, you might want to ask for your blood pressure to be measured in both arms. If there is a great difference between the two arms, that is indicative of something that needs some further examination. So when we have our blood pressure measured, we might be told that we have healthy blood pressure or that our blood pressure is pre-hypertension, or we might actually be told that we have high blood pressure. In general, people with pre-hypertension are being pushed to take drugs. And certainly after hearing the shows this month, I think that even with prehypertension, you will refuse those drugs. People with mild or beginning high blood pressure will also want to carefully consider whether or not taking drugs would be of any use for their health. Only people with extremely high blood pressure should really consider taking the drug. So let's talk a little bit about the drugs that are used and what kind of drugs that are used, and also just in general, if you are going to be using a blood pressure medication, or in fact any medication for your heart, interestingly enough, it is far better to take it in the evening. As a matter of fact, the closer to bedtime that you take that heart drug, the more effect it will have. Heart attacks actually tend to cluster in the morning hours, soon after we wake up, and taking a drug that lowers blood pressure as we go to sleep ensures against falls and dizziness from the effect of the drug. Most blood pressure medications circulate in the blood for 18 to 24 hours. So one way to take less medication is to take your medication at exactly the same time, but only take it every 24 hours, or if that doesn't seem to be good enough control, then to figure out a schedule of 18 hours, which is a little more complicated, but it does cut down on the amount of drug that you are actually consuming. Hypertensive drugs rob our bodies of essential nutrients. In general, when we're taking a drug that lowers blood pressure, we are going to be low in zinc, in vitamin C, in vitamin B1, B2, B6, B3, B9. We're going to be lower in potassium, magnesium, iron, calcium, and CoQ10, and our melatonin levels are going to go down. And these are very critical nutrients, not just for general health, but interestingly enough, they are quite critical for heart health. And this, we think, is one of the reasons why taking antihypertensive drugs is not so good for your health. So what are those drugs? The oldest of the drugs, and the ones that many physicians still prefer to use because they are old and they have a really good safety rating, are thiazide diuretics. Thiazide diuretics are often replaced by loop diuretics or potassium-sparing diuretics. So someone might say, oh, I'm taking a diuretic to lower my blood pressure, but that wouldn't necessarily give us all of the information that we want, because there are different types of diuretics and they actually work in different ways in the body. One MD that I was reading, who does a lot of cardiology work, says that he has not prescribed the daily use of diuretics for any patient for more than 25 years. Long-term use of diuretics increases the possibility of severe, life-threatening heart arrhythmias. It also raises the level of cholesterol, triglycerides, and other lipids in the blood. In fact, good studies have demonstrated that patients taking diuretics have an increased risk of death due to heart attack or sudden death as a result of the loss of minerals needed to regulate the electrical activity of the heart. In addition, diuretics can cause kidney damage. They can lead to gallstones and to gout. Taking drugs to lower blood pressure makes no sense at all for the vast majority of people. Lasix is one of the most common diuretics used, And like all diuretics, it causes an intense loss of potassium from the cells. This can actually impair the hair cells in the inner ear and the nerves that transmit sounds to the brain. In fact, damage to the inner ear occurs in patients who are given Lasix intravenously, but it can also occur with standard oral doses, especially when it is paired with other drugs such as painkillers. The side effects of taking Lasix include anemia, blurred vision, constipation, cramping, dizziness, fever, headache, high blood sugar, itching, muscle spasms, nausea, skin eruptions, purplish spots on the skin, hearing loss, photosensitivity, vertigo, and general weakness. Certainly doesn't sound like something that I would want to choose to make me healthy. Now, if we're looking at diuretics, there are certainly herbal diuretics. There's a great number of herbal diuretics, in fact. And herbal diuretics do not leach potassium out of the body. Plants like celery, parsley, and nettle are high potassium diuretic herbs. By diuretic, what an herbalist means is plants that help the body process water more efficiently while supplying lavish amounts of potassium. The potassium-sparing diuretics would seem to get around this problem, but unfortunately what happens is that they cause potassium levels to rise perilously high in the body so that they appear to interfere with the body's normal ability to adjust sodium and potassium to the right level for that body. Let's see if I have some specifics to tell you here about those potassium-sparing ones, and I don't, not too much written about them. So let's go on to the ACE inhibitors. ACE inhibitors don't weaken the heart. In fact, they may be the safest of the antihypertensive drugs. However, they do decrease selenium and zinc and increase copper levels. About 20% of people who take ACE inhibitors will develop a persistent dry cough, and that cough can start as soon as you start taking the ACE inhibitors, or it can take months to come up, and not necessarily linked to how fast or slow the cough starts. It can also go away as soon as you stop taking the ACE inhibitor, or it can linger for months. So ACE inhibitors are generally, by the most conservative physicians, used for immediate intervention only while you're getting yourself together with the lifestyle changes that are what you really want to do to make yourself healthy. Monopril is a drug used to treat hypertension and manage heart failure. It's an ACE inhibitor, which means it blocks the production of angiotensin. Angiotensin constricts blood vessels and relaxes artery walls. And because it blocks the production of angiotensin, blood pressure is reduced. However, it can cause swelling of the extremities, the face. It can cause extremely low blood pressure, leading to passing out and bashing yourself in the head. Not something to say, oh, it doesn't matter, because, in fact, people have died from this. Acupril is another ACE inhibitor, and it seems to carry all of the dangerous side effects of ACE inhibitors, but it also reduces the number of white blood cells in the body, leaving you particularly vulnerable to infection. And this ACE inhibitor tends to cause more kidney and lung damage. In fact, anyone with kidney damage or problems with their kidneys, simply because of that, should probably avoid antihypertensive drugs. And monopril, another ACE inhibitor, has basically just about the same kinds of problems associated with it. ARBs are a lot like ACEs, ACE inhibitors, angiotensin converting enzyme. ARBs are angiotensin receptor blockers. So in ACE inhibitors, the enzyme which is supposed to act on a particular hormone is inhibited. And in ARBs, the receptor for the angiotensin on the cell is actually blocked. These are sometimes used as a trade-off for people who don't seem to be able to tolerate ACE inhibitors. It seems to be quite effective, the ARBs, in preventing narrowing of the blood vessels, but there are quite a few problems associated with them. In fact, if they're used during the second or third trimesters of pregnancy, they can injure or even kill the developing fetus. If you have impaired liver function, you should use a very low dose of ARBs or not at all. In some patients, experience changes in kidney function while taking ARBs, which generally are reversible. It's important not to use a potassium supplement or a salt substitute containing potassium when you're taking an ARB. And so what that means is also that you should watch out about eating baked potatoes or bananas, both of which are very high in potassium. Calcium channel blockers are designed to alter a system in your body, and that is calcium, the entrance of calcium into the cells, to produce a lowering of blood pressure. That drugs that are calcium channel blockers relax the artery walls, but they also block the essential functioning of the heart, the blood vessels, the nervous system, the immune system, anything that needs calcium. In fact, people on calcium channel blockers to lower blood pressure experienced a 60% increase in heart attacks compared to people taking diuretics or beta blockers. Another study found that older people who took calcium channel blockers developed cancer at twice the rate of people taking other blood pressure lowering drugs. And diabetics should not take calcium channel blockers due to their effects on carbohydrate metabolism. Calcium channel blockers do take potassium from the body, and they elevate total cholesterol. And just a little warning here, if you are taking a calcium channel blocker, don't take it with grapefruit juice. One study found that the amount of calcium channel blocker in the blood jumped by almost 300% beyond the predicted levels when it was taken with grapefruit juice. So watch out for that. And then we have beta blockers and alpha blockers. A lot of different ways that we are looking to see how we can change people's blood pressure. The beta blockers and the alpha blockers, again, like the other ones, have the capacity to block the ability of the heart to respond to epinephrine and norepinephrine, two hormones that are produced by the body that affect pulse rate and blood pressure. Toprol, metoprolol, tenormin, atenol are examples of beta blockers. They do decrease the force and the rate of heart contractions, but that's rather like saying if you have some problem with your leg muscle, we're going to put you in a brace. It may be effective, but it's not necessarily going to make your leg any healthier. Beta blockers reduce heart function, and thus they can precipitate severe heart failure in people with reduced heart function. Even people without heart failure can develop a weakened heart after taking beta blockers for long periods of time. And people with bronchospastic diseases such as asthma and certain kinds of allergy leading to breathing difficulties should not take beta blockers. And as always, people with impaired kidney function should watch out for beta blockers because they can really cause some problems. We also find that ACE inhibitors and ARBs are not as effective as in African Americans as diuretics and calcium channel blockers. Calcium channel blockers thus are often the drugs of choice for African Americans. However, if you have gastroesophageal reflux, calcium channel blockers are probably going to make that worse. Here's another article about ACE inhibitor-related cough. And it's more common in women and more common in the elderly. Speaking of which, hypertension appears to do more damage to women than to men because women's blood vessels are smaller than men's blood vessels. A little stiffness makes them stiffer, and a little inflammation makes them more inflamed. There are significant differences in the biological mechanisms that cause hypertension in the sexes. The hormonal profiles of women with high blood pressure are not the same as those of men with high blood pressure. And thus, we would find that drugs that affect men may affect women quite differently. The general belief among doctors is that the therapeutic approach for high blood pressure should be gender blind. The drugs we use and the dosages we use, we have been taught should be the same for men and women. But, says Dr. Ferrario, that's not true. Women need to be treated earlier and more aggressively than men for any blood pressure problems. People with hypertension in the United States are taking on an average 2.5 medications to control their blood pressure. Taking these blood pressure lowering medications together adds a whole other level to the problems. All blood pressure medications cause gastrointestinal side effects, and they may lower blood pressure to the point where it leads to dizziness and fainting, especially when getting up from a seated or lying position. When we come back next week, we're going to talk just a little bit more about these problems with the specific blood pressure drugs. And then we're going to get into looking at the problems that are caused when they are used together. Hopefully, we'll also get to start looking at the lifestyle and herbal things that can actually change our blood pressure without using these dangerous drugs. Thanks so much for giving me this opportunity to talk to you all. Remember, herbal medicine is people's medicine. Thank you, Gemini.
Thank you, Susan. I look forward to coming back next week to discuss more blood pressure medicine and their issues. And this concludes part 49 of our series, The 7 Medicines the Wise Woman Way, with Susan Weed at Time Monk Radio.